long have you been working with some of these women who have active suits against Dr. Grawe? And can you tell me a little bit about some of the reasons why they connected with you and they decided to file a lawsuit against her?
The first one that came to me was, I think, a really egregious case. She went in for several procedures, one of which was a liposuction procedure, and it appears as if the cannula that was used to lipo some of the fat from her abdominal region actually pierced her bowel several times. She was to stay at what was called the recovery house, the Roxy recovery house, for several days. And what I've learned is the nurses and the recovery staff, for lack of a better way to describe it, would always encourage people not to call 911. They were not to go to another hospital. And fortunately, my client had the wherewithal to disregard those instructions. And she called the emergency squad. They came and picked her up. And she had to have emergency surgery. They actually removed some of her colon as a consequence of what happened. So if she hadn't had the stamina to actually disregard the instructions that they were giving her, she probably wouldn't be here today.
How many women is your law firm representing currently?
Presently 3. Many of the people who have contacted us are beyond the statute of limitations. Many of them had complications that may just be complications and not necessarily the product of substandard medical practice. But many of them have already missed the 1-year period during which, if they did have a malpractice claim, it could have been brought.
That the private Facebook group that has been created over the last several weeks with some of these women, going and speaking out, sharing some of their stories. A lot of them, talked about some of the complications that they have, whether it was right after surgery or, down the road. Are there the other clients that you're representing, were there complications immediately after their surgeries, or was it something, down the road? And how do you make sure to prove that those were related to the surgeries they had at her office?
Well, it's important to recognize that just because a complication occurs doesn't mean it was the product of substandard care. Sometimes people, as I've always said, have the best doctors providing the best care, and they still have consequences that nobody expected. It's the avoidable consequences, the consequences that could have been avoided but weren't with appropriate care, that are the ones that may have a medical malpractice claim. Some of them had complications, many of them have complications that could just simply have been a product of their own physiology, their own anatomy. So we look at those very carefully. You can't assume that just because something adverse occurred, that it was something that could have been avoided. Many of them have, and in fact, the recurring theme through all of the people with whom we've talked is they were told, almost, I want to say without exception, not to call the hospital, not to call 911, that if they had a complication, they would go to the Roxy recovery house, almost as if they just simply didn't want anybody to see the complications that were occurring. And there were a lot of them. I think the Facebook group to which you're referring now probably has over 1,000 people who have joined that group. Now, they were not all purported victims, but that's a lot of people over the span of about a week to 9 days.
Sure. I'm looking at the document now from the state medical board. And it highlights also some of a couple of warnings that Dr. Roxy received from the state medical board. I think the first was back from 2018, and that's regarding the consent form for those videos that she would post, whether it was a live stream during a surgery or just videos kind of showcasing Q&A or talking about different surgeries. But that first warning was in regards to the live stream TikTok videos or live streams on Snapchat that she would use to promote her practice. Is that something that was discussed with you and your clients in terms of, the patients I talked to had alleged, maybe she was focusing too much on her social media presence versus her patients?
The one thing that is absolutely clear is she had an intense focus on her TikTok presence. I am not well versed in social media, so I don't know where else she may have had a presence. I know that it seems like there was an inordinate amount of attention paid to her TikTok presence. And I'm told that many of the patients who went to her because of that presence. It's alarming from the perspective that there were times when she was performing a procedure on a patient, and instead of giving that patient 100% of her attention, it appeared to me, at least on one occasion that I saw, that she would turn away from the patient and address a camera, a telephone, whatever it was that they were using to record that, when she might have paid more attention to what was she doing with the patient.
The second warning in this is in regards to have patients having to go back for revisions for post different surgeries, and the board recommended that she take remedial education courses. It seemed that she did take those courses. She wrote a letter responding to the state board that she had gone through those procedures that they had recommended to her, suggested to her. But then it does say that she continued to produce and live broadcast medical procedures of some patients through or at least until October 14th of 2022. So from your perspective, hearing that, seeing that these warnings, but she did do those education courses, what's your take on then her continuing to do those videos post that warning?
The same concern that I expressed already. If she wasn't giving her full undivided time and attention to the patient during a surgical procedure, that is not the time to be doing a TikTok video or trying to solicit more business that way. I do know that she would obtain appropriate consents. There was, I'm told, some subtle pressure exerted on some of the patients who didn't want to be the subject of a TikTok video or have their procedure recorded. And she would be persistent about obtaining their permission in order to get that.
Late last month, her license was suspended. She had 30 days to request a hearing. And I did learn from the state medical board that she has requested a hearing. I'm not sure if there's a date scheduled quite yet. They told me they were working on some scheduling later this week. But what is your take on that hearing that will be taking place, and moving the next steps, especially from the mindset of the gals that you are currently representing?
Well, she's absolutely entitled to a hearing. An accusation is nothing more than that, an accusation, and if she can clear herself, then she should. On the other hand, I know that I would think that probably, although the state medical board will not tell me, I would bet dozens of complaints have been now filed against her as a consequence of the revelation, the epiphany of the TikTok pursuit that she had and some of the complications that have arisen. But the state medical board is more than qualified to decide whether or not she should continue to practice or under certain restrictions.
What would be, your advisement for the women you are representing, or to other people who may reach out to you over the next couple of weeks, months, with alleged complications, alleged victims? What would be your advice or conversations with them moving forward?
They're going to have a difficult time, and the reason why is because Dr. Grawe's license is presently suspended. She's not able to accept new patients or to work on prior patients. Those individuals who have complications are going to have difficulty finding a surgeon or a physician who's willing to work under the circumstances of repairing potentially somebody else's work. I know that there's one physician, I believe his name's Dr. Hauser, who has indicated that he's willing to help some of those patients. I'm sure some of the other local plastic surgeons are willing to pitch in as well, but it's more difficult for a patient of a prior physician to then go to a subsequent physician and have them repair or work with them for work that may not have been correct with a prior physician.
In your lengthy experience representing situations like this, have you ever seen a situation where so many people come out of the woodwork after that, maybe first or second whistleblower say, hey, this was what happened to me?
I've done this for 36 years. This is the first time I've ever seen such an overflow. And frankly, I don't want to even characterize it as an overflow like it's like I'm minimizing it. It's the first time I've ever seen anything like this.